So today we're going to be talking about acute renal failure. This is when your kidneys stop functioning properly. It can cause the chemical aspect of your blood to become unbalanced, and it usually occurs and happens very quickly. So acute renal failure can be fatal, but with the right care, it can be reversed and your kidneys can go back to functioning properly. So there's three main classifications of acute renal failure. So the first is intrinsic. So basically this is when there's some type of damage to the kidneys so that the inner parts are not working properly to filter out waste. So the second is pre-renal acute kidney injury. So this is basically when blood flow is stopped somehow to the kidney and prevents it from functioning properly. So the second classification is called pre-renal acute kidney injury. So basically this is when blood flow is stopped to the kidney, which prevents it from functioning properly. Okay, so the third classification is post-renal, and this is when the urinary tract is blocked somehow, so you can't excrete waste. So because of this, your kidney has a buildup of waste. Okay, so now we're on to the etiology, and I kind of described this before, but the cause of acute renal failure would be damage to the kidney, blocked blood flow to the kidney, or the urinary tract is blocked or obstructed somehow, leaving waste to build up. So there's a number of factors that can block or slow blood flow to the kidneys. It could be something like your blood pressure medication, cardiovascular problems, liver damage, things like burns, anaphylaxis, blood or fluid loss, and also severe dehydration. So there's also a number of things that could cause damage to the kidneys. This could include things like blood clots, infection, the autoimmune disease lupus, and toxins like alcohol. Okay, so what causes the post-renal issues? What causes the urinary tract obstruction? When you have things like bladder, colon, prostate, and cervical cancer, these can put you at risk for some post-renal issues. Also things like blood clots in the tract, enlarged prostate, kidney stones, and nerve damage. So acute renal failure falls into a lot of different syndromes. For chronic kidney disease, it's actually the last stage. Another thing it fits into is nephrotic syndrome, and this is when the blood vessels in your kidney that filter out waste are damaged, and because of this, we excrete too much protein in our urine, which leads to acute renal failure. Okay, so acute renal failure also falls under cardiovascular issues and heart attack, because anything that causes a depletion of oxygen in blood to your kidneys can cause acute renal failure. Also, any vascular diseases or disorders you have, acute renal failure could definitely fall into that. Things like vasculitis can affect the kidney directly and cause this. Okay, so now we're on to my favorite part, the clinical manifestations, the signs and symptoms. So some signs and symptoms of acute renal failure can be fatigue, confusion, shortness of breath, seizures or even comas, nausea, weakness, decreased urine output, and oftentimes swelling and fluid retention in the legs and ankles. Also, other important signs and symptoms that I didn't mention would be a sensation of pressure in the chest or even chest pain, and also a regular heartbeat. Okay, so how do we even know if we have acute renal failure? One test that is used to diagnose this is urinalysis. So basically there's two different things you do with urinalysis. One, you'll take a sample of urine and look at it under the microscope. You're going to look for some abnormal forms in there. You're going to be looking for excess protein, bacteria, abnormal crystals. And then also you could do the dipstick test, and basically it's a chemical treated stick that will turn different colors when it's in the presence of things that shouldn't be there, like red blood cells and excess amount of protein, like I said before, pus, and things like bacteria. So a good differential diagnosis for acute renal failure would be something called acute tubular necrosis. So they have pretty similar signs and symptoms, and acute tubular necrosis is basically when there's kidney injury caused to the kidney tubules, and what they do is when your urine is being formed, they uptake excess fluid and minerals. So the signs and symptoms that are similar would be decreased urine output, swelling and fluid retention, nausea, weakness, and fatigue. So now we're on to the complications. So there's a lot of things that could go wrong when you have acute renal failure. So I'll start out with the worst. The worst thing that could happen is death. You need your kidneys to survive and to filter excess waste from your body, and if those don't work, you'll die. Also, permanent kidney damage is another risk. So, of course, like I said in the beginning of the presentation, acute renal failure can be reversed with the right care, but if it's left untreated or not treated properly, you might have to be on dialysis for the remainder of your life. You could also have fluid buildup in your lungs, and you could have chest pain due to the pericardium on your heart being inflamed. And also, you could have some muscle weakness just because when your kidneys don't function properly, your electrolytes and fluids are off balance, which can lead to issues with your muscles. However, I also want to point out that acute renal failure, like all these negative outcomes I just listed, they're becoming less prevalent as medicine advances. And another thing is that people who usually develop acute renal failure are already suffering from another disorder or disease, and they're usually being hospitalized for this issue, and acute renal failure is just a complication of that. So if you have a pre-existing kidney disease, high blood pressure, or you're diabetic, these are some disorders that put you at a much higher risk for acute renal failure. Also, in order to prevent acute renal failure, you really want to pay attention to your over-the-counter medication and not take too many things like ibuprofen, Aleve, acetaminophen, because those are some drugs that can cause some direct damage to your kidneys. In order to prevent acute renal failure, you also want to make some lifestyle changes. You're going to want to eat healthy, exercise, get plenty of rest, and you really want to avoid things like alcohol and other drugs.